Welcome to today's Road to Wellness educational webinar. Today we're covering telehealth medicine and effective strategies for virtual visits with Dr. Ronald Falk. On our agenda today, we'll be defining telehealth, telemedicine, and virtual care, benefits versus limitations of telemedicine, how COVID-19 has impacted telemedicine, what doctors and patients say about effective telemedicine visits, and then Dr. Falk and I will discuss one of my telehealth experiences with him. We have 7 strategies for effective virtual visits, and finally we'll finish up with some questions and answers. I'd like to start today by introducing myself. I'm Kathy Olevsky, and I'm the 2020 host of the Road to Wellness webinar series. I'm a patient, just like many of you, living with vasculitis. Some routine blood work, followed by a kidney biopsy, confirmed the diagnosis of ANCA vasculitis back in 2008. I was in treatment for 6 years, and I'm extremely grateful to be off treatment and in remission for the last 7 years. I'd like to introduce our guest today, Dr. Ronald Falk. He's an internationally recognized physician scientist whose lifelong career has been the study of autoimmune kidney disease and ANCA vasculitis. Dr. Falk graduated from Dartmouth College and obtained his medical degree from the University of North Carolina School of Medicine. He served as chief of the Division of Nephrology and Hypertension at the University of North Carolina and is currently the chair of the Department of Medicine. In 2005, he became the co-founder and director of the UNC Kidney Center. He's a fellow of the American College of Physicians and a fellow of the American Society of Nephrology. He has served as chair or charter member of a variety of national institutes of health study sections and steering committees. He was the president of the American Society of Nephrology from 2011 to 2012, and he's the founder of the Kidney Health Initiative, a public-private partnership with the ASN and the U.S. Food and Drug Administration. Dr. Falk has received a number of distinguished professorships at UNC and was most recently honored with the Nan and Hugh Cullman Eminent Professorship. And he's received numerous honors and awards, including recognition as one of the best doctors in America every year since 1982. So now I'm going to turn things over to Dr. Falk and let him tell us a little bit.
Kathy, thank you so much for that really generous introduction. I think for the viewers, the most important thing is I've seen and taken care of lots and lots and lots of patients with vasculitis of all kinds. And I have learned so much from all of you. It has really informed what we've learned in our laboratories, and it's really informed how we take care of patients like Kathy Olevsky and so many others. So thank you for being you, and thank you for listening to this webinar. COVID-19 really launched the opportunity to spend more time with virtual care. That is, care not one-on-one in a doctor's office, but care using all the tools of telehealth or telemedicine, and they're slightly different. Telehealth is a broader term. It includes clinical and non-clinical services. So you can imagine getting pharmacy services, or you can imagine getting physical therapy services through telehealth, or you could learn how to do karate from Kathy Olevsky using a tele-karate approach. Telemedicine is really a substitute for the patient-physician interaction in an office. It's modern technology that is aimed at providing clinical care to our patients at different sites. Geography no longer matters. You can be in your home, you can be in your car, as somebody was yesterday, and we can take care of you as part of telemedicine, which is a portion then of telehealth. So what is then a virtual visit? What does that mean? It means that we are, as your provider, using video chat, video conferencing, a telephone, or a video monitor of some kind to replace your regularly scheduled visit. The advantage to you is that you get to do this from the comfort of your own home, in your own environment where you feel comfortable and safe. You don't have to drive, you don't have to park, you don't have all the hassles. And at this point in time, it's a safer opportunity because you will not be exposed to other individuals who may or may not provide a risk to your health. And it's now readily available. So video visits are more personal visits. I get to see you. I get to see what you look like in your home. Sometimes I get to see your cats. Sometimes I get to see your dogs or your spouse. Sometimes children migrate through. It's an in-person visit. In contrast, telephone visits also are useful. They're better when video technology is not available, and it depends on your broadband communication opportunities. Sometimes telephone is the best way to communicate, and all of these are different than what are called e-visits. That's when you complete a questionnaire or provide information online about your symptoms. And at a discontinuous or a separable point in time, the physician or the nurse can provide a response sent by a message through your electronic health account. So these are three different ways of being able to communicate back and forth using electronic media. So with us at UNC, there are three approaches. There's a video visit. It does require a high-speed connection. It does require some stability of the approach. It does require that you have a laptop or a smartphone that can do it. We have used a series of different internet opportunities. Epic is our electronic health record, or we can do this through Doximity. It can be used for during regular office hours. You can schedule your appointment, and then the visit automatically transfers into our electronic health media. Telephone visits. You can, if you have a telephone, it works. It doesn't require other equipment. It's convenient during office hours. And again, that information transfers, most of it transfers to the electronic health record. An e-visit, the advantage of it is it doesn't require during typical office hours. You could do it when day or night. You do have to have an account to be able to get access to it, but the information does transfer. And because it's discontinuous with respect to time, you could do it at midnight and I could respond to you at 5 in the morning. It doesn't require both groups to be available at the same moment in time. So the benefits of telemedicine. I think the big one is it allows continuity of care. Number one, it really provides access to physicians or other providers to individuals who are medically or socially vulnerable, because you get to be in the confines of someplace safe to you. And it's available for patients all the time, even when in-person visits are not practical or feasible. And there's another big one, another really important issue for all of you, and that is that geography is no longer important. You can get a consult or an inpatient visit if you're living in San Francisco and I'm living in Chapel Hill, North Carolina. It can be anywhere. And so you can ask for advice from anybody who has a part of the vasculitis network who has experience in your particular condition. And you can get other opinions. It's really an important tool to realize geography no longer is important if video visits work as well as they're working. So the other benefit of telemedicine in my mind during COVID is you don't have the risk of exposure from both health care individuals and other patients. Now, quite frankly, if you've been to a doctor recently, you're not going to see a lot of other people sitting in the waiting room. As a matter of fact, if you see anybody, it's unusual, but you will see nurses and you will see physicians. And we all have the possibility of providing some risk, although every one of us wears masks. Most of us are wearing goggles of some kind or the other. And we can screen patients for COVID 19 symptoms. We do for everybody. We take people's temperature, and if need be, we can refer you for testing. The other big advantage, of course, is preservation of personal protective equipment, and that's important for all of us as well. There are limitations for sure. Boy, do I like to see and talk to people. I've seen Kathy Olevsky both virtually and in person, and I still love in person visits. There's something intangible about being able to see and talk to individuals. It's best if there's poor connection. I do like to look at people's urine under the microscope, and I can't do that virtually, although I'd love to figure out how. Uh, I can see rashes. I can listen to lungs. I can listen to people's hearts. We're getting there with respect to being able to do this virtually, but not quite yet. And of course, there are issues for interstate licensing. Although I'm now licensed in multiple states, it's still difficult for patients in some parts of the country to really get an in person visit. Virtual care really has been around for a long time, years and years and years. It exploded because of COVID 19. And it exploded because it was really clear to our federal government, CMS, which is otherwise known as Medicare, and then its corollary, Medicaid. And so Medicare broadened the access to health services starting on March 17th. And they expanded the use of technology for routine care because they realized how important this was going to be during COVID times. It was absolutely there to limit the spread of viruses from one person to another in healthcare facilities. But Medicare and Medicaid and so many private insurers are indicating that they're going to continue this service because so many patients have found it so valuable. In fact, telemedicine is being used in incredible numbers of examples. It's a huge number of interactions. Whether it's going to be a billion by year's end, I don't know. But I can tell you I'm doing a lot of them all by myself. Surely not in the millions or billions, but a lot of them. The health visits surged from March timeframe up 50%. And now everybody is expecting these to continue and probably on the order of 1, 2, 300 million a year. And eventually they're going to be really commonplace. There are numbers of reports of how many of these are going to be done and how many millions or billions are going to be converted from in-person visit to telemedicine. But most of us are seeing 50 to 175 times the number of patients via telehealth than we did before we started. This is a common practice. All right.
So Dr. Falk, all that information is kind of amazing. I'd like to ask you a few questions, if I might, just to clarify some of that. First of all, when did you first begin telemedicine virtual visits? It wasn't in March. You had told me yourself you'd done this prior to this.
We did. I've been probably doing this for 5, 6, 7 years. And I was doing it because of patients who wanted to interact with me or other members of our practice from other places in the United States or quite frankly across the globe. And this turned out to be a really effective way of interacting with individuals. So I've been doing it for a while. It has absolutely become easier, and the whole approach has become easier over the past several months. But the technology has been there for years.
So has the technology evolved a lot, like this year, compared to, say, when you were collaborating with colleagues in other countries about, various things that you need to, projects that you're working on? Has it evolved a lot this year?
Absolutely. And what happened is it converted from more of a research or a one off experience to one where the information that was part of the visit went right into Epic, or right into whatever electronic health medium there was, so that it became much more part of a regular visit. Pharmacy, what medications the person was on, vital signs that a visit had occurred, and then the interaction or putting that visit into the health record so it could be seen by other providers in the same institution and others. That has really changed since March.
Well, so do you see a future in terms of greater development of communication tools, more sophisticated? Like, is this what's happened to us causing better virtual visits?
Oh, yeah, absolutely. And that has spawned a whole industry. I'd really like to listen to your lungs. And I think in the not too distant future, I'll be able to listen to your lungs virtually with you holding a stethoscope that's hooked to a opportunity for me to hear you just like I'm hearing you now. I
Wow.
can already see a rash. Electronic opportunities to have an EKG, hear your heart rhythm, are very much available now. Quite frankly, Alexa can hear and understand whether you're in atrial fibrillation now. Uh, and so a good old Alexa can do it, and these technologies can. Blood pressure monitoring is already available, and I'm going to be able to see that. So there's going to be an interface between just talking to you and then getting some vital signs, listening to lungs, listening to hearts in the not too distant future. I still am not going to be able to look at your urine under the microscope, though. That remains a problem.
Well, I'm pretty interested in this technology and all the things that you just described, and I would be the first one to jump on board and learn how to do those things. But what demands do you think will be put on patients and their doctors to keep up and adapt to this new technology that you're talking about?
Yeah, my biggest concern is broadband capability. How good is your internet provider?
Hmm.
Because this does use a lot of high speed back and forth communication. And the place that it is most difficult, we've discovered, is in rural areas of our
Yeah.
country that don't have good internet access. You live in Raleigh, and so your internet access is wonderful. And the person who is helping us with this webinar lives in Pittsburgh, and he has good internet access. If you live someplace where internet access is not as good, that's where the limitation is going to be. It's not going to be on other technology. It's going to be on broadband access.
Hmm.
Yeah.
Well, maybe you can take over now and tell us a little bit about if somebody's never had a telemedicine visit, what they should expect.
Okay, so there's multiple ways of doing this, at least with us. You can get through your MyChart portal or whatever portal you have with your electronic health record. Doximity turns out to be another portal that many people have used because it works on an iPhone and it works on an or a smartphone of any kind quite easily. And then there are other WebEx team approaches that are popping up one after the other. The important part is you can schedule a video visit just like you can schedule a normal in-person visit by calling your provider's office, uh, stating your preference. I want a video visit, I want a telephone visit, or I want to have an in-person visit. And each one of these have become unbelievably routine.
Hmm.
So if you haven't had one, this is what I would suggest you need to do. It's important that you figure out how to access whatever healthcare system you're doing so that you can get in through your own patient portal. And if you have, I'm sure many of you have gone in through your patient portal to see labs, to talk to your physician. That's the usual way of getting in. And you can download an app. Most places will allow easy downloading of an app so that you can start your televisit. Again, you can download an app through Doximity, and that seems to work as well. And then the provider, one of us, will send you a link on your smartphone as a text message when the appointment's set up, and then all the information with detailed instructions on how to log on. The first visit's the hardest. The
Yeah.
first visit's the hardest. Downstream, it gets easier. Hold on for a minute. That's not a COVID cough, Brian, and you can't get it in any case living in Pittsburgh, just to let you know. So there you go. Once you're logged on and you've gone to the first visit, you'll enter what's called a virtual waiting room. And that's a little annoying because you're saying, oh my goodness, where is the doctor? Oh, yes, but you can have a cup of coffee or tea. You're sitting in your own house and you're waiting for the physician or nurse practitioner to log on. Then, once you're logged on, we can see that you're there. In our system, a little green camera comes on that says, the patient is sitting in the virtual waiting room, and we can log on, and then the visit should be able to come on. Many times a nurse begins the virtual check-in, and that's really helpful. What's your temperature? What's your pulse? Are there new issues? And they can go through your medications before the visit starts. And then once the physician or healthcare provider of any kind comes on, then it's just like a regular visit. Please make sure that you can look into a camera and everybody can see everybody. That's a big part of the problem. Are you able to see me? Can I see you? And you should ask your physician or nurse practitioner, can you see me? Can
Hmm.
you see, can you see my face? Can you hear me talking? Is the volume okay? And that's really acceptable approach. Both parties need to make sure they hear each other and see each other. If it's a video visit and if it's on the phone, can everybody hear each other well? So lots of times, if you have a new rash, I want to see it. So please make sure that you can lift your leg up or take your camera and point it down so that you can see a rash or see a joint or see something that you want us to see, just like you would do in a doctor's office. Another way of doing this, though, is to take a picture of something that you want to have us see and upload it as you're coming on. And this is very easy in many patient portals.
So,
So go ahead.
Dr. Falk, I was just going to say that that bit about uploading a picture is very helpful because I did have to do that one time. So it's good to learn how to do that. But I wanted to say that doctors and patients have said through various interviews that we've done, total maybe similar things, maybe different things. So we kind of wanted to explain today a little bit about what we did in our research. We had some conversations with doctors in advance, and we gathered some information from patients off of some of our vasculitis forums.
Good.
And so, if I could share today, what I heard from doctors is that they may need more training on the use of software and AV equipment that's needed. Also, they often want the patients to know that they'd like them to be prepared with their latest vitals, blood pressure, probably body weight, heart rate, that sort of thing. And doctors would like to have quality cameras and microphones to do the visits. Also, they would like to ask the patients to do the virtual visit in a distraction-free environment and find a quiet room to get the best audio possible. So when we were talking to patients, Michael said, please notify me if an appointment is running late while I'm in the virtual waiting room, or have a way for me to ask staff about delays. Sheila said, doctor or staff to instruct me on what I need to do to prepare and have with me so I'm ready for the virtual visit. Thomas said, tell me honestly if we should have an in-person visit or if it really can be done virtually. And then finally, we heard ask the doctors to do a virtual visit in a distraction free environment, much like the doctors asked of the patients. Kind of interesting that parallel there. So, this is what doctors and patients have told us. What do you think, Dr. Falk? What are your feelings about this?
I agree with so many of them. I think they're spot on, actually. Uh, I do my visits in one of two places where I know the equipment. I'm sitting in my own office right now and I know my equipment really pretty well. And if there's a problem, I can fix it. Similarly, if I'm in a clinical exam room, I want to feel comfortable with the equipment. And it's really important for me as a physician to have practiced with it before I ask a patient to be the first guinea pig. So there has to be a lot of training. You can't do this for the first time as a physician. And just the patients are absolutely right. The environment on both sides, the doctor and the patient, should be quiet because any background noise or people coming in and out of the video make it really distracting. Although I must admit, I do like to see cats and dogs and kids in people's houses because it provides me with interesting context. Uh, the Michael and Sheila are also absolutely correct. It's so unpleasant to be sitting in a virtual waiting room. You don't know how long to sit there. Am I going to can I leave? And it's very important for the patient to be able to ping the staff and say, hey, what's going on here? And many times I can tell you, just as you may have to wait in a doctor's office for the physician to come in, sometimes issues prolong both video and in-person visits. So before you are put into a virtual waiting room, the patient should say, wait a minute, if you are going to have a delay, please let me know so that I can plan accordingly. And that's a perfectly acceptable thing to do. The second point that Sheila makes is really also important. It turns out that we have figured out that nurses spend 1.5 times the amount of time getting patients ready for video visits than they do for inpatient visits. And the reason for that is exactly what Sheila's bringing up. It's important for the patient to feel really comfortable so that they're ready for the video visit. And that requires the nurse or nurse's aide to spend time helping the patient feel comfortable getting ready for that environment. And then, Thomas, you're right again. There are times that I really want to see you. There are just a whole bunch of intangibles that I'm just missing. And so, yes, we need to be honest. Next time you come, I really would like to see you in person because I need to do things that I can't do by video. All those are right on.
Well, let's talk about some strategies for effective virtual visits. I know that I heard, well, maybe you want to talk about this, Dr. Falk. Do you think these things that say doctor on the slide are what you should be doing is for effective virtual visits?
So, absolutely, they're right. Who on earth are you? Are you a talking head? I'm Dr. Ronald Falk. I'm from the University of North Carolina in Chapel Hill. You should know who I am. You should absolutely have that information. And if there are other people involved, who are they? The other thing that physicians do, and incidentally patients do as well, is don't get distracted.
Mm-hmm.
You wouldn't get distracted in a physician's office looking around, looking at your email. You really need to concentrate. You get all those cues in. So physician, don't get distracted is absolutely right, and never interrupt a patient. That
Right.
should be always.
I think as a patient, it's really important to write down any questions that you need to ask because you're just like when you go into the office, you need to have thought of these things ahead of time because they always occur to you after the fact.
Right.
So that's a good thing just for these virtual visits as well. I had been asked in the virtual visits that I've done to in advance check my weight and blood pressure. I do have a blood pressure and my temperature. And I do have those things at home, so I've been able to do that. And I have learned to think of the video visit as if I'm in the doctor's office and to make sure I'm in a quiet, distraction free room. That was not my experience in one of my visits, and I felt very badly about that visit. But I think we're going to talk about that in a little while.
So I have a
Any
seventh
other
one.
any other effective strategies you want to add in there?
I do. There's a seventh one. I think that patients should ask, are there things that you're missing by doing this as a video visit or by phone that would be different if I came in person? And what are those things that you're missing?
Yeah, that's great. I think those are 7 really good strategies. So now we get to talk a little bit about virtual visits. And in case anybody has not figured this out, I can tell you that Dr. Falk is my doctor, and I have had a virtual visit with him and last week an in-person visit with him. And I can tell you, I guess I hope he doesn't remember this, but my virtual visit, because of my environment, did not go well. I was prepared greatly by UNC for how to do my virtual visit. I did everything that they sent me all the information. It went smooth as it could go. I logged in. I was in a virtual waiting room. It was no problem. And then Dr. Falk and I believe Dr. Chen came on. And shortly after that, I had forgotten to close the door, and my 8-month-old 80-pound puppy ran behind me, was dragging things back and forth
I
across the room.
loved it. I loved it. I got to see your dog. I got to see something more about you. There's a social history that we all take, but there I got to see your dog. It was wonderful.
Yeah, it was distracting for me as a patient, though. I kept looking at her when you said she was dragging my husband's judo uniform. I looked and it was a judo uniform going across the room behind me. So it was maybe more than I would have liked for you to see, but also it was a little bit like I wasn't thinking. So two things. It made me very much at ease and comfortable with you, but also it was because you guys were great about it, but I felt like I wasn't paying enough attention because of it. So I would advise other people to close the door and not have your puppy and your kids come in while you're having do you have anything else about virtual visits that have been interesting or something that you would advise against? You can't
So,
obviously tell. You can tell anything about mine.
well, I think that one of the interesting parts about video visits from patients' homes is that we get, as physicians, now to learn something about who you are outside of the sterile clinic room. And be careful and think about what you want as your backdrop. Obviously, TV personalities do this and they stage it, but ask yourself the question, what is it that you want behind me? What is
Yeah,
it that you want people to be able to see? And sometimes you don't want to have anybody see anything, in which case just put up a sheet or something that blocks out things behind you. And that should be an intentional kind of process that you go before the video visit. But on the other hand, you might want the physician or nurse to be able to see things, something that's important to you, some trip, something about you, something about who you are, and then it's a really useful prop. But Kathy Olevsky is right. If there's a lot of distraction, we physicians get distracted too, and that's not good for either party.
right. Well, I think if it's okay, I'll finish up with some questions from you and from me, and you can answer all of them, of course, because I have a whole list of them that came from various patients and a few from me that I thought would help the listeners today. Um, I think the first one is if we're going to do telemedicine visits, what is the basic equipment I should have? Do I need microphone, camera? What basically do I need?
So if you're going to do a telephone visit, you need a phone and you need to make sure that is in good working order. If you can do FaceTime on your computer, you probably can do a video visit. It's basically the same equipment, which means it has a camera and it has a microphone. And most of the time that works well.
So if
Get
I was going to say, if I'm used to doing FaceTime with the grandkids or something on my iPad or tablet, that probably would work for the same thing.
It does. It does. And if you have other kinds of equipment, many laptops or computers have cameras and have microphones built in, and they typically work remarkably well also. Said differently, don't go out and buy a bunch of equipment unless you have that equipment for other purposes.
Okay, and so I think one question that came up that we touched on a little bit is how are my vitals checked and communicated to my doctor? I know when I go in the office, the nurse does all that. So
Yep.
how does that happen on a virtual visit?
I hope you have a scale. Get on your scale in the morning, put down your weight. If you have a thermometer, it's good to take your temperature. And then I think for most patients with vasculitis, having your own blood pressure monitor is a good thing to have in any case. So please take your blood pressure before the visit. Remember, you need to sit in a quiet place for 5 minutes with your legs uncrossed comfortably and then take your blood pressure. Don't do it just 3 seconds before your visit because it will be artificially high.
So that was one of the questions was one of the basic home medical tools that I might need if I'm going to do video visits. I probably should have a blood pressure monitor, a thermometer. One question was, do I need, I think it's called an oximeter to check my oxygen levels?
So a pulse ox is the abbreviation. It usually fits over the finger. Um, If you have lung problems or respiratory issues, it might be a good idea, but usually those are pretty expensive or they can be expensive. You also have to know exactly how to put them on so
Mm,
that you get the correct reading. Here's my finger, and I'm pretending I'm a digital pulse ox, and I'm sitting there like that with it on. Remember, if you have fingernail polish on, it cannot work. It may not give a good reading.
mm.
I'm more inclined to say don't get one because they can be expensive. And if you do have a pulse ox or a pulse oximeter, take it to your physician's office and make sure that it's working well. Please take your blood pressure monitor to your physician's office and make sure they check it out also.
Great advice. I had gotten that advice about my blood pressure monitor and did bring that in and get it checked. So it's good to know that we should and can do. How about when I come into your office after we're through? I usually go get some lab work done. So what do we do about lab work and televisits?
I think that you should ask your physician, do you need labs? If I do need labs, the physician should ask, what is the closest place to you where you can get your lab? So in North Carolina, you can get them from LabCorp, which has offices all over the place. Quest Diagnostics has labs all over the place. So your physician should help you be able to get laboratory studies done locally as long as that laboratory will provide those studies back to your doctor or just as importantly to you, the patient.
Okay. So what about documents or information? Is there anything I should send ahead of the virtual visits? Sometimes there are questionnaires and things.
All we like to have information of other provider visits, and those could be sent to us, and we'll scan them in. Or if you can scan them and send them, that's always hugely helpful. Questionnaires you can scan or send back to us. Any information that you think is very important to us.
Okay, so what if I need to show the doctor something like a rash? As a vasculitis patient, this kind of thing does come up. Or some visible health problem. Do I take a photo of it ahead of time, or am I going to show it to you somehow during the virtual visit, or both?
I think you should. That's a question you have to ask yourself. If it's a rash in some place that's going to be difficult to show in front of a camera, please take a picture first and upload. But you have to know how to upload the picture in order to be able to have that work. On the other hand, you can show us with your camera places of concern to you during your visit. It requires you to feel comfortable picking up your computer or your camera and pointing it at the place that you want us to look at, but that works pretty well also.
I can tell you from personal experience that I did contact you, tell the viewers this. I did contact you because I had a rash on my arms and I wanted to make sure it wasn't vasculitis. We're always worried about that as a vasculitis patient. And as it turned out, I had massive poison ivy. So
Yeah,
I I did take pictures ahead of time and send them, and I did show it to you on, and also to a dermatologist on the video. So,
Because I couldn't figure out what it was. It's absolutely right. It was a interesting rash, and I wasn't sure I knew what it was. But our friendly dermatologist did a video visit, a dermatology video visit, and said, that's just poison ivy.
so
Don't worry about it.
it's good to know that that's how that's done. I have heard from some patients that they're worried with video visits about security and privacy. They want to know, for instance, is the session being recorded? Will I be told if it's being recorded? Is anyone else going to be able to watch this and access this for like training or education purposes?
So no video visit should be recorded, and that's absolutely your right to ask that question. Is this being recorded? I can tell you none of ours are recorded. And if we have learners of any kind, they need to introduce themselves, say who they are, and what their role is, just like it would happen in a physician's office. But no, it should not be used for any purpose other than the equivalent of an in-doctor, in-person visit.
Well, that is the message I keep hearing. So that's really important to hear from you is that it should feel like the same as if you were going in the office and other things. But these are questions that patients have in the
Sure.
back of their mind. So
Sure.
that's why we ask them.
Right.
Um, how do you handle an exam if it involves needing a patient to show private areas, or are there some guidelines for that sort of thing? That just
That's really difficult. I'm just going to tell you that. And it turns out that is probably a very good reason to do an in-person visit. I've had patients feel very uncomfortable with that.
right.
It's hard to do that with a video visit. I've had my gynecology colleagues talk about this specific issue. They'll tell you they really can't see things well. That's more of an in-person visit at this point in time than video capability.
Okay, and also, how about because we're talking with vasculitis about vasculitis and vasculitis patients, do they have any specialized, are there specialized challenges for video visits with vasculitis patients, maybe because of skin conditions or anything else?
So I can tell you where the three areas are: ear, nose, and throat. I can't see your nose other than what I can see. Uh, so often we really want to have an ear, nose, and throat physician look into your nose, sinuses, and subglottic area. That must be an in-person visit, at least for now. I can't listen to your lungs. Why are you having a cough? What do I hear? The default then would be to get an x-ray, but you shouldn't get the radiation unless you need it. If you're having a cough, boy, would I like to listen to your lungs. And as a kidney doctor, there's no substitute for spinning down your urine and looking at it under the microscope. A dipstick of your urine just is not as good as me looking at your urine myself. It's those three areas that really trigger an in-person visit rather than a video or telephone visit.
Yeah, those all sound like that would be true. This last question is an interesting one. Is a virtual visit billed separately or differently from an in-person visit? Like, how is the billing and insurance sort of thing handled?
There are 100 different answers to that question, and
Yeah.
so it's not an easy one. From the physician side, video visits right now are billed just like an in-person visit. If you go to a hospital-based facility, there is no facility fee, although Medicare is changing that right now. Uh, every
Interesting.
insurance company is dealing with this in different ways. Uh, I'm hopeful that it's the same as a typical in-person physician visit. It should be of value to you as the patient. There shouldn't be extra fees associated with it. High value, low cost, or standard cost should be the mantra for all patients and all healthcare providers. It should be what's good for you. That should drive it.
Hmm. Well, I think, at this time we want to probably both have some final thoughts of our talk today. I can tell you as a patient, for me, um, I feel a lot better about televisits. I've had four, and I know not everybody has done that, but I've had four with four different doctors, and they've all gone very well. I had a lot of these questions about. I didn't realize my first one that I should have taken my blood pressure and my weight and my temperature and stuff beforehand because it was very close to the beginning of COVID, and I was so feeling so sick and so scared and I was relieved to be able to do the virtual visit instead of having to go into an office because I was a vasculitis patient who was scared about contracting COVID. And as it turns out, my primary care doc decided that I needed a COVID test to make sure that the symptoms I was having were not COVID or were. And in my case, it was not, but I felt good doing it from my home and a lot less scared. I think other things for me would be the security. I feel good knowing now that it's not recorded and that it's taken very seriously by the doctors, just almost as if you were in the office with them. So those are kind of the things that I got out of this today. You have some final thoughts on this process?
I think this is really a good opportunity for vasculitis patients or anybody with an autoimmune condition to be able to interact with their doctor or to get opinions from other physicians who they want to learn from. It opens up a whole world of possibility for everybody. It's never going to be a full substitute for in-person visits, but it's a wonderful extra alternative.
I totally agree with that. Um, I want to say thank you, of course, to our sponsors. But Dr. Falk, thank you so much. I have enjoyed having a relationship with you for 12 years. I have told many people that I'm your favorite patient, but then since
Absolutely.
I know four of your other patients, and they all think they're your favorite patient. So perhaps that is not correct, but I'm glad that you still act like it is. And I did want to thank our sponsors today, GlaxoSmithKline, Genentech, and Sanofi for their support of our Road to Wellness webinar series. They are helping the Vasculitis Foundation provide these valuable educational webinars, and they really support our commitment to creating patient education. I also did want to mention that the Vasculitis Foundation will be featuring 3 webinars, all focused on the aspects of telehealth. I would like to encourage our viewers to visit the Road to Wellness webinar page on the Vasculitis Foundation site to see all the different webinars we've done this year. Actually, you can just Google 2020 Road to Wellness webinar series and it'll come right up for you. And speaking of the Vasculitis Foundation, their website, please visit them at vasculitisfoundation.org to find a great resource for patients with vasculitis. And of course, special thanks to Dr. Falk for helping educate us on telehealth and telemedicine today.
Thank you. Good to see you.